Good day everyone. I am Sharon Dave A. Barrera, a first-year nursing student. So I'll be demonstrating cardiovascular system assessment. Cardiovascular system is similar body that supply oxygen and nutrients which are needed to do our daily activities. So doing cardiovascular system assessment will help us to identify factors that could affect our cardiovascular health, such as high blood cholesterol, hypertension, diabetes, and some other stuffs that both common and uncommon. The first thing that we need to do is to review our client's medical records to determine the scope of the assessment. And since I'm done, I'm going to prepare the necessary materials prior to meeting the client. So for this assessment, we'll be needing a rectangular cord or ruler to measure our jugular venous pressure. Next is our pen light, a tangential light source, and lastly, our stethoscope to auscultate heart sound. Alright, so before having contact with our client, let us perform hand washing first to prevent the cross-contamination. So, good day, ma'am. My name is Sharon Dave A. Barrera, a student nurse of Davao Doctor's College. So, may I ask your full name, ma'am?
My name is Mia Monica A. Peralta.
Okay, and how old are you?
19 years old.
Okay, and what would you like me to call you, ma'am?
Just call me Mia.
Okay, Ma'am Mia. For today's assessment, so we'll be doing a cardiovascular system assessment. So, Ma'am Mia, I'll be with you for your cardiovascular system assessment. With that, I'll be touching some parts of your body and I'll be palpating for your neck, your peripheral limbs, your arms, and your legs. And also, I will listen to your heart sound if it will be fine for you. Okay. Ma'am, do you have any question or clarification before we start the assessment? Okay. Okay, Ma'am Mia, I will be closing the curtains so that no one can see you from outside while doing our assessment. So, and rest assured that all the information that I have gathered, it will be remain confidential between me and your attending physician that I'll be referring to, okay? So, before we start, how do you feel today? Okay, good. So, have you experienced any shortness of breath? Any dizziness? So, headaches? Okay. Bababa ako dahil. Have you had any history of heart diseases?
No.
How about anyone from your family? Okay. So, okay, Mamiya, do you smoke? Okay. Alright, so... Okay, Mamiya, I'll be at your side so that I'll be closer to you and to your right side, to your neck, and I'll only give you your recline around 30 degrees, okay? Okay. So that we can promote normal breathing during the procedure, okay? So I will be shining a pen light to check for your neck if you can you tilt your head that side Okay. I'll shine a light. Okay, other side. Okay. So, your right external regular vein is flat and without the distension, and if ever that I have found any distension, I will have to locate the highest visible point of the distension of the interjugular vein. And if needed, I could also lower and raise the bed to help with the observation of the distension. Okay, so this time, I'll be measuring your jugular venous pressure by measuring the sternal angle of your right angle using this ruler that I have here. Okay. Face that side. Okay. Makita ba po sa ano? Makita ba akong procedure?
Oh, makita.
Oh. So, here is normal. Okay. So this time, I'll be palpating for your carotid artery. So can you tilt your head over there? Okay. So the other side, please. Okay. Now, ma'am, I'll be auscultating for your current artery using the dial of my stethoscope so that I can hear the low-pitched sound of your... Okay, can you tilt your head? Okay, inhale. Exhale. Hold your... and then hold your breath. Okay, other side. Inhale, exhale, and then hold your breath. Okay, can you relax now, ma'am? I haven't found any carotid root bilaterally on your carotid arteries. Okay. Alright, for the next part of the assessment, ma'am, I'll be inspecting and palpating for your precordium or chests. Okay. But I need you to expose your chest, if it's okay with you, ma'am. Okay, can I drape it now? Okay. Okay, can you hold this, ma'am? This one. Okay, I'll be inspecting your aortic. Okay, I'll be inspecting your aortic, pulmonic, tricuspid, and apical areas. Okay. Okay, thank you so much, ma'am. hips. Okay? So I will go into grip again. Okay? I will be placing my fingertips obliquely on your external border and under your apex is directly with your hand. Okay? Okay. Tricuspid. Normal. Okay. This time I'll be palpating for the trills and or vibratory sound. It caused by turbulent flow on your chest. So I'll be using the bell at the ball of my hand to palpate. Okay. So I will drape again. Okay. 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 So I haven't found any vibration, which is good. No vibration. Occur. So now I'll be palpating for your tricuspid. So it will take few minutes, ma'am. Okay. So I will drape again, ma'am. Okay. I already checked for your impulses, which is all normal. Okay. The next thing will be your apical impulse. So I'll be palpating for your apical area using the 3 finger. Okay. So I'll be using this 3 finger. I will drape it now. Okay. Okay. Since, ma'am, I'm able to palpate your apical impulses, I will not reposition you, okay? So, everything is completely normal, so no need na to reposition you, okay? So this time, ma'am, I'll be palpating for your epigastric area. It's right under the external border. So I need 3 fingers to palpate it. Okay. So I will drape it now, ma'am. Okay, ma'am, I'm done. I will recover you with the drape. Everything seems normal. So, now I'll be assessing for your heart rate using the diaphragm of my stethoscope. This one, so I will first clean it. Okay. So I will place it in your apex. So I'll be assessing for the heart rate and rhythm. Okay, so your heart rhythm is completely normal. Okay, so this time I also be getting for high pitch on your aortic, pulmonic, tricuspid, and apical area. Okay, can I give your rate? Okay, so I will now ask the date. Okay, so okay, so now I'll be using the bell of my stethoscope for low pitch sound, okay? Okay, good. So I will be repeating the steps earlier, ma'am, but this time I'll be needing you to face laterally on your left side. Can I remove the grate, ma'am? Okay. So, ma'am, yeah, I will start now. I'll be using the bell of my stethoscope for high pitch sound. Okay. So, okay, ma'am, I need you to inhale, exhale, and hold. Okay, inhale, exhale, and hold. Inhale, exhale, and hold. Okay, relax, ma'am, and relax now. It's all normal. Can you go back to your supine position? This time, Amia, I will do the same process, but I will use the bell of my stethoscope, okay? Let's do the same thing again. Can you face again laterally on your chest? At this time, I'll be using the bell of my stethoscope. Okay. Inhale. Exhale. And hold. Inhale. Exhale. And hold. Okay. Inhale. Exhale. And hold. Okay. So you can relax now, ma'am. I will assess you back in your supine position. Bell stethoscope is normal. Okay. This time, I'll be examining your upper extremities, Mamiya. So now I'll be assessing for your peripheral vascular system. So I'll be moving your upper extremities toward your lower extremities. So I will lower your arms, lying down on the bed. Just relax. Okay. So I will be inspecting for any lesions of your skin, any discoloration, and the symmetry of the arms. Seems it's all normal. And now I'll be inspecting or palpating for your temperature. And your skin is warm to touch, which is normal. So independent position of the limbs. There is an extension of the veins, and when this elevated, the vein will collapse. So seems everything is normal. The skin, no discolorations. The temperature is normal. This time, I'll be palpating for your radial, ulnar, and brachial pulse, ma'am. Okay? So, first is your radial. Here is your radial. The other side. Okay, next is your ulnar. Next side. Okay, and your brachial. Okay, the other side. Okay, so pulses are full and symmetric. Okay, ma'am, I'll be assessing for your capillary refill. Okay. Other side. Okay, so your capillary refill is less than 2 seconds, which is normal. So, ma'am, for your Allen test, I need you to close and open your hand as quickly as you can, okay? So, I will hold your left. Okay? Okay, where is your
I will removing your ulnar. Okay, so close and open your hand as quickly as you can. Left side on. Okay, I will now. So on your right side, okay, close and open as quickly as you can. Okay, so close and open as quickly as you can. Okay, then close. Okay. Alright, that's it. So everything seems normal. Okay, mom, since we're done assessing your upper extremities, we'll be moving on the lower extremities. So first, I will assess your peripheral vascular system and on your lower extremities, okay? So move. Okay. So I will going to remove this strip on your leg. Okay. So I'm going okay. So I will be observing here for any symmetry of your legs. Okay. So symmetry. Okay, good. Your pulse, your skin, for any lesion, and also for the temperature. Okay, your skin is smooth, so let's check for your temperature. Okay, your temperature is warm to touch. Your skin rather is warm to touch. So now I'll be also checking for your edema. Okay, there is no edema occur, also no lesion. Skin is intact and warm to touch. Which is all normal. Lower extremities. Normal. Okay, so independent of limbs, here, there's an extension of veins that, but when it's elevated, like this, the distension collapse, alright? So this time, ma'am, I'll be palpating for your femoral pulse, popliteal pulse, dorsalis fetis, and posterior tibialis. So for femoral pulse, can I left your right arm? Okay, so I will grab it, ma'am. Alright, next is your popliteal pulse. Okay, the other side. Okay, so, and your dorsalis fetis. Okay, other side. Okay. Okay, that's it. Gisabay ko naman left and right. Tama. Normal. Okay, so for the last test that I will be performing, ma'am, is the human test for checking the deep vein thrombosis. Alright? So, I will drape in your left leg, okay? So what I'm going to do, ma'am, is to do a dorsiflex your leg and foot check for your calves, okay? So, remember. Okay. Okay. Next, other side of your leg. I'll be dorsiflexing your foot and your calves. Okay. All normal, so I'll be checking for your capillary refill. Okay, so your capillary refill is both less than 2 seconds bilaterally. Everything is normal. Capillary refill is less than 2 seconds, which is normal. Okay, so I think Ma'am Mia, I'm done. So that's it for our assessment. So for today, I'll be summarizing everything the data or the information that I have gathered throughout my assessment, okay? So Ma'am Mia, all your vitals are normal and haven't found anything abnormal, okay? That is related for your cardiovascular health, okay? So Ma'am Mia, if you feel anything unusual later, you can call the nurse. Just push the call button to call for the nurse, alright? Okay, so thank you Ma'am Mia for being cooperative and wonderful patient, and I'll see you around, okay? Now that I'm done performing the assessment, I will do the aftercare and to perform hand washing to deter the spread of microorganisms. So that's it for my cardiovascular system assessment.